Hello, this is a presentation on stewardship, particular antimicrobial stewardship. It's part of the National Standard number 3, which is on preventing and controlling healthcare acquired infections. So let's delve in. So first of all, stewardship at the Mater. So I found the definition of stewardship, or what it is to be a steward, in the core documents that we have available in our organization, and thinking of the code of ethics and so forth. So the definition is a steward is a selfless servant who manages assets without owning them, anticipates future trends, and devises strategic plans. The notion of stewardship as a responsibility for protecting and developing one's resources is a key principle of Christianity and many other faith traditions. So I hope you're familiar with this principle because it's at the core of how we are to be at this organization. Let's look a bit more at stewardship at the Mater in the next slide. So stewardship is ethically based, and some particularly relevant aspects for us to reflect on are: firstly, the importance of taking responsibility for the health and safety of everyone, including ourselves. I hope that makes sense. The call to be stewards of scarce resources, including care of the earth, material resources, management and development of people, and their talents. And thirdly, thinking of the gifts we each have been given and how we share and build upon our intelligence and knowledge. So really at the core of our organization, we are invited to perform at 100% of our ability and contribute. And when it comes to antimicrobial stewardship, we'll see there is room for improvement in compliance. And so we're all part of the healthcare team, and we can be alert of what are the right practices, the best practices, is it adhered to in every scenario, and have ongoing discussions perhaps or evaluations with the medical people in our team to be responsible and be as effective as we can based on our intelligence, knowledge and talents. So here we go to the next slide. So background information: antimicrobial resistance is an urgent global health priority in which common and treatable infections are becoming life-threatening. And we do not escape this threat at Mater in Brisbane or anywhere else in Queensland. Use antimicrobials only when needed, so reducing unnecessary use when there is no evidence of benefit. Select antimicrobials wisely, using narrow spectrum drugs where possible. So once cultures come back with results, we can often switch from broad spectrum to narrow spectrum antibiotics. And use safe and effective doses, prescribing the correct antibiotic at the right time for the right diagnosis. All right, let's move on. In our department, we mostly use antibiotics in a prophylactic strategy, and the national standard describes the clinical care for a patient having surgery that requires prophylactic antibiotics as documentation of indication for prescribing it in the first place. Surgical antibiotic prophylaxis has to occur in accordance with guidelines. The timely administration of prophylactic antibiotics prior to surgery, and the cessation of prophylactic antibiotics after surgery. Let's have a look at best practice advice. No, we're going to look at challenges first. So Australia is one of the highest users of antibiotics in the developed world, about 22 million scripts are written every year in primary care. In 2017, 2 million hospital beds days are lost to healthcare associated infections every year. So that's an estimated cost of $1 billion. Other challenges were the compliance with guidelines and the timing of procedural administration. So best practice. Finally, we arrived there. So prescribe antibiotics according to therapeutic guidelines within 1 hour prior to surgery. Redose if required, and postoperative antibiotics are avoided for clean contaminated surgery. So thank you for listening through this presentation all the way to the end. Um, I hope it gave you some good pointers to be an effective steward, an effective member of the team, and be alert to the correct use of antibiotics according to the therapeutic guidelines and best practice principles as listed in this presentation. So thank you.